EpiPen. And I pass out.
Good afternoon, Mr. Diaz. My name is Myra. I'm your nurse today. How are you feeling?
Can't breathe.
Well, I'm sorry to hear that. Yeah, I heard you had a bee sting and you're allergic to them, so you kind of had a reaction, a really bad one. Okay, luckily your neighbor was able to call someone. Do you know where you are? Where are you?
Hospital.
Okay, do you know what day it is?
Sunday.
Okay, let me just verify your name. Give me your complete name, please.
Diaz.
And your date of birth?
I don't remember right now.
Okay, let me wash my hands really quickly and then I'm going to give you a quick physical, okay? Okay, so let me just look you over really quickly, okay?
You see my neck is so swollen I can't breathe.
Yeah, I see that. Okay, let's check you out really quickly. Breathe in and out for me very deeply. I hear some wheezing. I hear some wheezing.
What's that, nurse?
It's when you're making noises when you breathe. Here, sit up for me. Sit up a little bit. Thank you. All right, keep taking deep breaths. Wheeze. Keep going.
I can't breathe anymore, nurse.
Okay, yeah, I do hear some wheezing. I'm gonna check your pupils really quickly. Okay, let me turn off the light. Can you cover one eye for me for now? And just look straight ahead. Okay, cover the other eye. Okay, thank you. Okay, so let me see that neck of yours. Yeah, it looks like it's pretty swollen, and your face is a little swollen.
Do you see the rash?
Yeah, there's kind of a rash there. It's a little red. Do you have rashes anywhere else in your body? Let me check out your arms and check your pulses while I'm at it. Let me see. Okay. Okay, so do you have any rashes anywhere else?
I don't think so.
Okay, well, we're gonna give you some like corticosteroids, and PT will be here to help you with your breathing. He's gonna give you a nebulizer. Okay, that's to help you expand your airways. Okay, so you can breathe better. So let me know when your breathing is difficult again. That way we can give you some more epinephrine. And in the meantime, we're gonna be giving you corticosteroids, and I believe what else was on the order for you? And which is Benadryl and some Solumedrol, okay? And I'll be back to check on you again in a minute, okay? All right.
Hey Jackie, how are you?
Good, how are you?
Haven't seen you in a while. How are your kids?
Good, they're doing good.
How about you?
I'm okay, hanging in there.
Good.
So let me give the report on our patient, okay, Mr. Nahum Diaz. He's a 25-year-old male, admitted to the ED or ER with bronchoedema, broncho constriction,
Okay.
and yeah, his neck is kind of swollen, and he had wheezing, a headache, dizziness, hypotension, itching, and the diagnosis is anaphylactic shock. It says he was stung by a bee, and it just so happens he's allergic to bee stings.
Okay.
So that's why he was found by his neighbor on their lawn, like passed out with a dog, but the dog didn't run away.
Okay.
But yeah, so he has a history of alcohol and marijuana use and gang banging and asthma. So yeah, that's that. His labs show that well, his WBCs are slightly elevated, but that might be as a side effect of the epinephrine.
What was the value?
12.5.
Okay.
His RBCs are within normal limit. Shows elevated eosinophils.
So the
yeah.
response.
Yeah, that's his allergic response. His H was normal, and let's see, and his CO2 was elevated, so possible acidosis, and his O2 was low, pH was 7.28, so yeah, I guess a little bit acidotic.
Okay.
So he has an IV on his left arm, 20 gauge. He's receiving normal saline at 100 mils an hour. Let me see what else I have here.
Do you have his vitals for this morning?
Yeah, his vitals are, temperature was 98.9, so that's kind of normal. His heart rate was 130, so slightly tachycardic,
Okay.
and it was also kind of weak, and I can barely like palpate the carotid pulse, so probably because of the edema. His respiratory rate was 35, so a little tachypneic. Blood pressure 90/46, so that's kind of low, hypotension there. And his pulse ox was 89, so we're trying to bring that up a little bit. When I assessed him, I noticed some erythema, and obviously the edema around his neck. Said he was slightly itchy, and I checked his pupils, they're kind of dilated, so, but they're symmetrical.
Okay.
And obvious wheezing when I checked his lung sounds, and bronchospasms and some shortness of breath.
Is he on any mask? Or?
Yeah, he's on an O2 non-rebreather mask.
Okay.
And PT should be coming in to administer the nebulized albuterol.
Okay.
So currently, like I said, he's on IV normal saline. He's also on, like I said, albuterol, and he's getting Benadryl IV, 50 milligrams,
Okay.
Solumedrol, and we have epinephrine for him, PRN, like every 5 to 15 minutes as needed.
Okay.
So, yeah, we're just trying to stabilize him and make sure that his edema is reduced so that he can breathe better. And I guess that's it.
Okay.
Did I forget anything? Okay, so I guess that's it. So
I'll check up on him. Thank you.
All right. I'll see you later.
Okay.
Bye. Bye. Mr. Diaz, you're looking better today. Do you know where you are?
Yes, I'm in the hospital.
Do you know what day it is?
It's Sunday.
Okay, good. Yeah, so you're looking pretty good. We're going to be discharging you pretty soon. But before we do that, we need to talk about how to take care of yourself once you're out of the hospital, okay?
Okay.
You actually did the right thing, you know, as soon as you felt that bee sting and you were feeling the symptoms, you shot yourself up with an EpiPen. So it's really important that you carry one with you all the time, okay? I kind of recommend you get a medical alert bracelet. That way, when the ambulance comes and the EMTs look you over, they know what you have, and they can provide you with care more quickly. So what do you think about doing that?
Sure.
Okay. And very important, just stay away from trees with buzzing noises, okay? Because that normally means there are bees around. And stay away from bullets.
Okay.
Because according to your history, you're allergic to bee stings and bullets, right? That's what you wrote. Okay? So I'll be seeing you. I mean, hopefully not anytime soon.
Hopefully.
But
you know.
good luck to you, okay?
Thank you.
I'll be back.